raise your hand if you've ever had back pain from sitting for too long, or woken up with a stiff neck that wouldn't go away. What if I told you there's a drug-free solution that's been used since the 19th century? I first discovered chiropractic care after a car accident left me with chronic back pain and trouble walking. As you can see, I'm doing much better now, but at first I was hesitant, like a lot of people. I didn't fully understand what chiropractic care was, and I wasn't sure it would help. But the results surprised me, and so did the science behind it. So today I wanted to share a quick history of chiropractic care, the kinds of techniques used today, and what research says about its benefits. So let's start where it begins. In 1895, a man named D.D. Palmer performed the first chiropractic adjustment in Iowa. His patient was Harvey Lillard, who was a janitor and partially deaf for 17 years after a neck injury. After the adjustment, Harvey reportedly regained his hearing, and this led Palmer to the theory that misalignments in the spine could affect the rest of the body. He believed if the spine was out of place, it could mess with the nerve signals and cause all kinds of problems. The human spine is made up of 33 vertebrae, and between each vertebrae are these discs that act as cushions and help absorb shock and keep things flexible. Running through the spine is the spinal cord, and the nerves branch out from these cavities to the rest of the body. If a vertebra is slightly out of place, it could press on nerves and throw things off. This is called the subluxation. When that happens, you might feel it in ways you might not expect, such as digestive issues, headaches, or limited mobility. Back then, not everyone believed in the new treatment. In fact, early chiropractors were often arrested for practicing without a license. However, during the 1918 flu pandemic, patients who saw chiropractors recovered better, and people started paying attention. Fast forward to today, chiropractors are licensed in all 50 states, and over 70,000 are practicing in the U.S. Even in the VA, who serve veterans, include chiropractic in their health system. But what does a trip to the chiropractor look like? Most people just think back cracking, but there's a lot more to it. One method is called the diversified technique, where the chiropractor uses their hands to quickly and precisely adjust the spine. Another is the activator method, which uses a small tool to deliver gentle pressure and is ideal for people who prefer a lighter touch. They also use things like special tables to stretch the spine, ultrasound therapy to reduce inflammation, and electrical stimulation to relax tight muscles. Most chiropractors also give stretches and exercises to do at home, because the goal isn't to feel better for just a day, it's to help the body stay aligned for a long time. But does it actually work? A study published by the Journal of the American Medical Association looked at over 26,000 people and found that chiropractic care worked as well as common pain medications without the risky side effects. Other research found that it could reduce the number of headaches by about 50%, help athletes recover from injuries faster, and prevent future back problems. It is also super safe. Serious side effects are extremely rare, less common than risks from everyday painkillers. Something a lot of people don't know is that chiropractic can help with sleep and stress. When the nervous system is balanced, the whole body functions a lot better. So let's recap what we've learned. Chiropractic care started with one adjustment that changed everything and evolved into a science-based practice with many techniques. Today it's backed by research and trusted by millions. In a world where we're quick to take a pill for pain, it's good to know other options, natural ones that help the body heal itself. So next time your back aches or your neck feels tight, don't just walk it off. Sometimes the best medicine isn't a drug, it's letting the body back into alignment. Thank you for listening. Are there any questions? Are there any questions?
How long were you in chiropractic care for?
I was in chiropractic care until April of last year, starting in January of last year. So in total, it would be 4 months. They gave me exercises and stretches to do at home, as I mentioned, and were very nice and helpful people.
What's the best way to find a chiropractic fit for me?
The best way to find a chiropractic fit for you would be to do your research, but also ask the people that you trust most, and consider what you prefer in a chiropractic care, such as, are you looking for gentle pressure? Are you looking for something quick and easy? It really depends on your preference.
Okay, thank you.
Do the discs between the vertebrae have a name?
Yes, they're called intervertebral discs, which in short means between the vertebrae, discs between the vertebrae. Is that all?
I think so.
Okay, thank you for listening.
Thank you so much.
Thank you for all the information and your story.
Of course.
Amazing. Have a good night.
You too.
Bye-bye.
That's all.